Good afternoon. Thank you for joining us for the National Conference of State Legislatures webinar, Lead in the Water, Policy Options to Replacing Lead Service Lines. Today's webinar is hosted by NCSL. For a schedule of upcoming webinars, please visit www.ncsl.org. My name is Doug Farquhar, and I am the Environmental Health Program Director at NCSL. I'll be moderating the webinar today. Today's presenters will explore the hazards from lead in water and policy options for states to undertake to address this threat, including options for replacement, providing insights into the tools and approaches states have undertaken to address lead in drinking water. Before I begin, I want to mention that this webinar is being recorded and that the registrants will be able to access a recording of the webinar and also the slides of the webinar on the NCSL website. We will be sending out a notice shortly after the webinar to link to these resources. Our speakers today are Dr. Jennifer Lowry with Children's Mercy Hospital in Kansas City, Missouri, who will speak on the health hazards of lead in young children. Rebecca Morley, former director with the Health Impact Project, a collaboration between the Robert Wood Johnson Foundation and the Pew Charitable Trust, who will discuss a recent report from the Health Impact Project on policies to prevent and to respond to childhood lead exposure. And our final speaker today is Tom Neltner, Environmental Defense Fund, Washington, D.C., who will speak on the Lead Service Line Initiative. Our presenters will be answering questions after the final presentation. Please type your questions into the question box on the right side of your screen at any time during the webinar. To begin the webinar, I would like to poll the audience to get a better sense about some of the information you may have regarding lead in water and lead service lines. The first poll question is, how many of you have thought about lead in drinking water before the situation in Flint, Michigan occurred? We will give you about a minute to answer that. And it looks like a majority of you knew that there was a problem in lead in drinking water before Flint. That's good. The next question I would like to ask is, how many of you know if you actually have lead service lines in either your home or if lead service lines are part of your community? And it looks like a majority of you know that there are lead service lines in your community, but quite a few of you don't know if there are lead service lines or not. Almost 30% do not know if we have lead service lines in their community or not. That's very interesting. With that, I'm going to turn the slides over to Dr. Jennifer Lowry, who is our first speaker today. Dr. Lowry is the director of the Pediatric Environmental Health Specialty Unit at Children's Mercy Hospital of Kansas City, and is a professor of pediatrics at the University of Missouri, Kansas City School of Medicine. She is also the chairwoman of the Council of Environmental Health for the American Academy of Pediatrics. Please join me in welcoming Dr. Lowry to the webinar. Dr. Lowry?
Thank you very much, Doug, for having me. I'm very excited to be part of this webinar series. So some of you may be wondering why you're seeing this particular title to my talk, and I'll get to that at the end. But just want you to remember that there are canaries out there, and oftentimes what happens is children are surrogates for a bigger problem. And so this is why it's important that we talk about lead. All right, so I got to figure out if I know how to do this. There we go. Okay, so I have to let you know that I do receive funding from the Agency for Toxic Substances and Disease Registry and the EPA through the American College of Medical Toxicology, and that funds my work as in the pediatric environmental health specialty units. Every federal region has PACU, as we call them, in which I and my in the network provide pediatric expertise in regard to environmental exposures in children and provide consultation should children get exposed and need our help. So I have a couple of objectives here today to go through with you. I'm first going to talk about lead in a bigger view, to talk about the adverse effects of lead and kind of how we got to where we are in regard to lead. And then, because we are clearly talking about lead in water, I really want you to understand what contribution lead has, or water has, in regard to lead exposures, and then who are particularly susceptible to having those exposures. So just a little bit of background. Lead is a metal that occurs naturally in the Earth's crust. So we can't escape it. It's going to be there. It's actually a breakdown product of uranium. It is the softness and the malleability, low melting point. It's resistant to corrosion, ability to make metal carbon compounds. It's low cost and it's easily workable. And because of all those things, it really has made lead very useful to be put into things to help that product. And while we no longer use it in paint or in gasoline, we actually still do use it in batteries, in solder, we don't actually put in the pipes, but we know we have pipes that have lead in them. And again, what we are talking about today. It's also in roofing materials, and it's in some cosmetics. We actually still do have lead in gasoline and for aviation. So we haven't completely taken it out, and it is actually still used in paint, like on roadways and other commercially. It is not broken down. It's not biodegradable. It stays around forever, and so that becomes a problem. So just to give you a little bit of history, though man has been using lead for a really long time, the usage of this metal increased during the industrialization. That resulted in serious health effects. Although we do know that the health effects even occurred before the 1900s, and we know that the toxicity has dated back to the 2nd century BC, and probably even before then. There are some that theorize that it was one of the causes of the fall of the Roman Empire due to its causing infertility and decreased life expectancy, in addition to deaths that were related to poisoning. It was also present in a thing called sapa, and sapa is a preservative used for wine that used to be used. And we've had lead pipes for centuries and millennium, really, that carried water and sewage. And it was really during this Renaissance period that lead toxicity was known to cause death in famous painters due to the use of lead in paint. Sorry, I'm working on my moving the slides to go forward. In the 14th and 16th centuries, there was a clear recognition of lead as a poison, and it was particularly noticeable in occupational hazards for goldsmiths, metal workers, miners, potters, and painters. And there's some documentation that physicians made recommendations during this time to take preventative measures to avoid poisoning, such as keeping the windows open, covering the mouth with a rag, and avoiding the aspiration of dust during these because of the occupational hazards. And lead also continued to be used as a wine preservative in that sapa and resulted in outbreaks of colic across Europe. In the 19th and 20th centuries, chronic toxicity of lead became better understood by physicians. There was a widespread use of lead paint in residential settings, and it also occurred which led to significant rise in lead poisoning in children. And this had previously been considered mostly an occupational issue. But during actually the late 1800s and early 1900s, there became an international discussion of the need for legislation protecting workers and consumers from lead toxicity. And there was implementation of legislation in multiple countries and internationally because of the deaths that were occurring in children from the ingestion of lead paint. And due to the recognized significant toxicity, it was actually removed from paint for residential purposes globally in the early 1900s, except in the United States. We were the only industrialized country to continue to use it until the 1970s, when it was removed from gasoline that are used in cars and lead paint for residential uses. So here is a little figure that, and there are a number of them out there that you can look for, but this shows the adverse effects that can occur in children and adults. And it's important to recognize that there are two different things happening, well, lots of different things happening, but they're going to be different between the child and the adult. Because as you know, when children are born, they're not born done. They continue to grow. Their brains are not done until about 25 years of age, although there are some 23-year-olds who might argue with me about that. But the optimal time of that brain growth and when we really learn how to do a lot of things where those connections are really being made is at 0 to 3 years of age, when it is so important that we keep our bodies healthy. And unfortunately, that's the prime time when children have high hand-to-mouth activity and put things in their mouth. Adults, when they get exposed to things, I mean, we're done. We're done growing. Our brain's connections are made. We don't have anything else to grow and connect. And so there's going to be differences in what those exposures show. And so for kids, the primary reason we really care about lead is because even at really low levels, below even the current reference level of 5 micrograms per deciliter, we know that there's IQ decrements. We know that there's cognitive disabilities. We know that there's behavior problems. As it gets up to 10, we have even more decreases in IQ. They're going to have hearing problems and growth problems. As it gets closer to 20s, 15s, and 20s, we have some attention problems. It can actually affect bones because as we have extended exposures to lead, it actually gets into our soft tissues, to children's soft tissues and into bone. And the half-life, or the amount of time for half of the lead to get out of bones, it can be decades. As it gets higher, it interferes with our hemoglobin synthesis, and so kids get anemic. And then at even higher levels, they can have seizures and result in death. So because we have recognized that lead is so toxic, and it isn't that lead has become more toxic over time, it's just that our science has improved to show that what we thought was safe for lead is no longer safe, that there were differences, there were things happening to children even at these lower lead levels. So as Doug mentioned, I am the chair to the Council on Environmental Health for the American Academy of Pediatrics, and we published in 2016 our most recent policy statement on the prevention of childhood lead toxicity. And in there, we clearly talk about the harm that lead has to children, but primarily recognizing that in order for us to overcome the issues of lead, we actually need to prevent the exposures from happening in the first place. And so it's really trying to recognize where those sources are. Also in the policy statement, we recognize that there are multiple different sources of lead that children can come in contact with that can result in an increase in their blood lead level. And these kids can actually be exposed to all of them and not just one or the other. And there are times in a person's life or in a child's life when one of these media is going to be more dominant than the other. But by far, the source of lead that is more common in resulting in elevated blood level is lead in dust from paint. But you can see there that lead in water can contribute up to 20% of that child's increase in their blood level. So there are multiple studies that are there or have been published, and I've chosen a few of them to talk to you about. So a once celebrated cost-cutting move for an economically distressed city, you know, this is what happened in Flint, right? So the water source changed, and now it has untold economic, population health, and geopolitical burdens. And with the unchecked lead exposure for more than 18 months, and it's fortunate the duration was not longer, as we know that this was a longer case in Washington, D.C. Even so, that drinking water crisis was a dramatic failure of primary prevention. There were legal safeguards and regulating bodies designed to protect those vulnerable populations from preventing the lead exposure, and those failed. And that failure resulted in the percentage of children with elevated blood lead levels increasing after that water source change. And it was particularly a problem because these were socioeconomically disadvantaged neighborhoods, and these were children already at risk for not only having lead exposures from other sources, but also trying to overcome the adverse effects that occur within poverty itself. And so it's really important to recognize that water is a growing source of childhood lead exposure because of the aging infrastructure that we have in our communities. And you know, Dr. Monahana Tisha has spoken frequently around the country on this issue, but Flint is just the tip of the iceberg, as a colleague of mine, Dr. Carleen from Indiana, has said. It's not whether it will happen again, it's a matter of opening the eyes of how extensive it is already. And while many would argue that the reason we are discussing lead in water is because of what happened in Flint, yes, this was the impetus of the current conversation, but this is not a new phenomenon. This has been known to be a problem not only for decades, but has also been blamed for the fall of the Roman Empire, like I spoke about. And unfortunately, it brought attention to the plight of many in that lead is ubiquitous and poisoning children across the country, where Flint actually is the new norm and used for a comparison of harmful levels. So this was the Washington, D.C. Study that came out from after those exposures that I mentioned. Mary Jean Brown was the head of the lead poisoning prevention branch at CDC, and she was involved in assessing what those children's blood levels were due to lead service lines and the water disinfection. And so what happened between 2000 and 2006 in Washington, D.C., they assessed children that were living in homes with a lead service line. And what they found is that there was an increased risk of having higher lead levels than children in homes without a lead service line. Seems intuitive to us, but again, people don't know, as the poll showed, whether you have service lines or not. And children living in houses where there was a lead service line that was even partially replaced after 2003 were still more likely to have elevated blood lead levels than children living without a lead service line. So as we go on and we have conversations about whether we should partially help replace a service line or not replace a service line, there can be just as much damage by only partially doing it. It's either an all or nothing thing. But children are exposed to multiple sources of lead, and that includes water. So they're, for children that have these low blood lead levels below the previous action level, a number of different sources could be contributing to that, including water. And so continued exposure to lead in water from many different, from water with also other sources can explain those risks. However, we need to remember that we cannot just do partial service line replacement. Again, Washington, D.C. and Flint are not the only places in the country that have problems with lead and water. There are high rates of lead poisoning across the country, and here's one in Fresno, California. So despite national strides in eliminating lead-based products, hazards remain in areas that are far from the Rust Belt or East Coast regions that have old housing and legacy industry. There's a long history of heavy industry in California, and the city of Fresno battles high poverty rates and problems with substandard housing and are both at risk for lead exposure. But in addition, they also have unsafe levels of lead in their homes, prompting the lead testing, and found that there's elevated lead levels in the water itself. And so children continue to be exposed. And unfortunately, many of them don't have tests done, so we don't even know how many children have elevated blood lead levels. Hoping I could go back. So then we talk about schools, right? Due to the aging infrastructure, schools are likely to have environmental hazards that impact staff and students. Over 90% of schools in the country have no mandatory requirements under the Clean Drinking Water Act for testing, and there's limited guidance on how to remediate the problem when they do find lead in the water. Only schools that have their own water source rather than receiving water from a municipal system must sample regularly for lead and meet those standards. And so while the water from the municipal system may be free from lead, the old age of many schools around the country make it more likely that they contain lead pipes, faucets, and drinking fountains. So schools in Boston, Chicago, Portland, Los Angeles, Seattle, Baltimore, Newark, New York, and the District of Columbia, among others, have found elevated lead in their water and have installed water filters or brought in bottled water for children to drink. And in fact, the U.S. Government Accountability Office found that while the EPA suggested that the number of drinking water systems with elevated lead levels had dropped in the last couple of decades, their data failed to contain recent test results that accounted for 30%, that failed to account for over 30% of large and medium-sized community water systems that actually had not implemented the rule. I'm trying to advance. There we go. So who is at risk? So infants age 0 to 1 are the ones who are primarily at risk for elevated blood levels from water, especially if they're drinking baby formula that has been reconstituted with obviously toxic water. So for example, if you have 50 micrograms per liter of lead in water, it's predicted to elevate the lead in blood above 10 micrograms per deciliter for about 50% of that population. But even having just 4 micrograms per liter, or 4 parts per billion, it would be enough for 10% of the population to exceed a blood level of 2 micrograms per deciliter. Please remember that there is no safe lead level, and we are talking about children under the age of 1 who has primary brain growth during that time, who should have no exposure to lead. Formula-fed infants are at high-risk group due to their small body weight and heavy reliance on water as a major component of their diet. Additionally, children's lead exposure at schools, where children are exposed to an entire distribution of water lead levels, can also have increased blood lead levels. And one study showed standing samples had lead concentrations ranging from below the level of detection to 50 parts per billion, which is higher than the EPA's current water standards, which is not a health-based standard. In addition, pregnant women are encouraged to drink water over any other beverage. And so if you are a woman in Flint, Michigan, and you're drinking water, you, as you saw on my graph about what happens to adults, the adult woman may not be significantly harmed from those same lead levels, but her fetus will. And again, that is the primary place of growth in their neurological system. So I told you I'd get back to the canaries and and why I call it that. This is how I commonly end some of my presentations, because a lot of people don't know what this is. And I can't clearly ask you that, but this is the cage that they would put the canary in the coal mine. They'd put the canary in, they'd shut it down, and they'd put it down in the coal mine, and then they'd wait, and they'd see what happened. And so then after a period of time, they'd bring the canary back out, or the cage back out, and if the canary was still alive, awesome, they got to go to work that day. But if the canary was dead, then they would know that they could not go to work because the air quality in that coal mine was bad. What I'm saying is that children are the canaries in our coal mine in regard to lead, because we get them poisoned first, and then we test them, we find out they're elevated, and now we have to try to play catch up, when the primary focus should actually be primary prevention, where the canaries are never used. And with that, I will turn it over to Doug or Rebecca.
Thank you very much, Dr. Lowry. And once again, if you do have questions for Dr. Lowry, please type them into the question box and we will answer them at the end of the program. Our next speaker is Rebecca Morley. Ms. Morley was the director of the Health Impact Project at the Pew Charitable Trust, and she used that project to build a culture of health by fostering cross-sector collaboration and creating healthier and more equitable communities through the health impact assessments and related tools. Ms. Morley also was the director at the National Center for Healthy Housing, where she led efforts to create safer and healthier environments for all people. And prior to that, she worked at the U.S. Department of Housing and Urban Development and at the U.S. Senate, where she was responsible for major children's environmental health laws and regulations. Please welcome Rebecca Morley to the webinar. Rebecca?
Thanks, Doug. Thank you so much, and thanks for all of your leadership on these issues of environmental health and childhood lead poisoning over the years. It's a pleasure to be here today. I would like to acknowledge the Robert Wood Johnson Foundation for investing in the research that I'm about to present. And admittedly, when the idea of this report first came up, I recall thinking and saying that lead poisoning is one of the best studied public health problems, and I was frankly skeptical that our research would yield much in the way of new findings. But what we found was both confirmatory and alarming. We confirmed that there are practical solutions to this problem that have been delivering great results in many states and cities. But we also found that even at today's much lower blood load levels, the cost of the problem is significant in terms of human and in economic terms as well. So what we did for this report, and admittedly, this report was on the heels of Flint and Calumet and many of the other places where we were seeing this spotlight on lead as a significant public health problem, a problem that many people thought was solved years ago. This report was meant to put in one place the research around lead and practical solutions so that decision makers at the federal, state, and local levels could feel confident in moving forward in advancing solutions. So we assembled the top national and international experts that included economists, epidemiologists, statisticians, engineers, pediatricians. Over 40 people were involved in the development of this report, bringing varying levels of expertise to ensure the rigor of our work. Next slide, please. I'll give you a little bit of an overview of the methods that we used, which was a mixed methods approach. And if you advance 3 times, you'll get the entire slide. Thanks. So the mixed methods approach included qualitative and quantitative research. The qualitative research included focus groups in 8 places, 2 groups per place for a total of 16. We did 5 national listening sessions. The National Center for Healthy Housing and our partners at the Trust for America's Health collected case studies from around the country to help document the policies we were studying in practice. We reviewed over 700 research articles for this report to bring to bear the most recent research in science. And we conducted 50 interviews with key informants and experts. The quantitative work came from our friends at Child Trends and Urban Institute. We used the social genome model, and then we used something called the value of prevention tool, which is a cost-benefit tool of the Alterum Institute. And so what we were trying to do is to look at the problem from multiple angles. Just as background, the social genome model calculates how exposure to a certain effect or intervention ripples through a child's life. So, for instance, in this, how does lead affect reading, math, and behavior? And how do those outcomes then affect things later in life, like graduation rates, criminal convictions, and teen pregnancy? Alterum's value prevention tool helped us quantify the costs and benefits, and that looks at the impact of lead on IQ, and then all of the outcomes that stem from IQ, including things like lifetime earnings, and then the impact of earnings on government revenue. But also the value prevention tool calculates savings to government spending for health and social services. And then for the oversight of the project, we had senior leadership at Pew and RWJF who provided very careful reviews of the document and guidance overall. Next slide, please. Our focus groups, as I mentioned, were in 8 locations that you can see here on the slide. There were about 130 people that participated. You can see some of the demographics here about them. The annual household income of the participants was about $19,000 for about 25% of the participants, about 35 to 45,000 for about 17% of the participants. About half of them had college degrees or above, and 57% of them owned their homes. Next slide, please. One thing that was clear from the focus groups is that context really matters. So for the folks that we talked with in Los Angeles, air and soil were significant concerns associated with a local lead smelter. And in Flint, clearly water was top of mind for folks. Whereas in Baltimore and Philadelphia, we heard a lot about renovation activities that were going on that were not regulated or controlled and that were creating hazards both on the outside and the insides of homes. So whatever solutions we put in place will need to take into account the local situation. We also heard pretty typical barriers that you would expect, the cost of remediation being an obstacle to intervention, and a widespread lack of awareness. People said if I had just known, if someone had told me that this was still a problem. I didn't expect that lead would be in my water. I didn't know it was still in housing. Who knew it could be tracked in from the outdoor soil? So just a real sense that people didn't have the information they needed to make decisions. And kind of that coupled with really a widespread distrust that government had their best interests at heart. And so that is one of the obstacles we're going to have to deal with in terms of intervening through government agencies. And I think partnerships with local community-based organizations are just going to be critical. Remedies that they provided, and we did ask folks to give us ideas for solutions, included greater awareness campaigns at the local level, and then also funding for remediation. Next slide, please. So I'm going to give you a quick rundown on the quantitative findings. The report is 130 pages, and I'm going to do this in about 5 minutes, so bear with me. And then at the end, you'll see a link to the report where you can find both a short overview or the executive summary to the document, as well as the full research. And also, our friends at the Trust for America's House have put together several briefs, and including ones focused on state policy. So those will be of use to you as well if you want just a brief overview. All right, next slide, please. So to save you from doing the math, I'll tell you what the big number is. It's $84 billion is what we estimated would be the economic gains if we were able to keep blood lead levels at zero. This is a hypothetical exercise that we ran to see what is the maximum potential benefits that we can achieve through the prevention of exposure or prevention of blood lead levels rising above zero. This is not a net number, it's a gross number, so we haven't accounted for the expense of intervening, but it gives you a little bit of a sense of the distribution of the benefits and the maximum potential benefits. Importantly, this number is for only one birth cohort, the kids that are going to be born in 2018, and I've said before, don't think about this as kind of random kids. These are, if you know anyone who's expecting right now, these are their babies that we're talking about, the trajectory of their lives. And then in a few instances, we estimated the benefits of younger siblings. You could imagine the next generation being born into the same household that's been treated. We modeled 4 lead poisoning prevention policies: lead hazard control, lead service line replacement, enforcement of EPA's renovation, repair, and painting rule, and then the removal of leaded gas from piston engine aircraft. So we'll go to the next slide, please. All right, so we'll start with this one. Jennifer alluded to it. A lot of people didn't know, and including I wasn't aware that gasoline is still leaded for some uses, and in this case, for piston engine aircraft, these smaller aircraft used for hobbies and smaller flights or shorter flights. And the use of lead in these aircraft contribute to about 450 tons of lead being emitted into the environment every year. And studies have shown that the surrounding neighborhoods, the airports that service these aircraft, are affected. FAA is working on some solutions to phase lead out, but unfortunately, probably not fast enough. The current phase-out period is scheduled for 2022. And so we estimated what would be the benefit for the 2018 population if we were to accelerate the pace of this phase out, and we would affect more than 226,000 children and generate more than $262 million in future benefits. Next slide, please. So Jennifer explained the risk of lead in drinking water and also talked a little bit about the partial service line replacement. So in our estimates, we looked at what would be the cost and the benefits of fully replacing lead service lines, knowing that that's the most public health protective. And we found that it would protect more than 350,000 children. These are kids born in 2018, but also younger siblings that would be born in the next 10 years into the homes that have been treated. And this returns about $1.33 for every dollar invested. Next slide. Eradicating lead paint hazards. This particular intervention is focused on homes that were built before 1960 because they are more likely to have lead-based paint. About 72% of those homes will have lead-based paint. And we also focused on low-income housing since low-income families are disproportionately burdened by the disease. Doing so, intervening in these homes with lead hazard control will provide benefits of about $3.5 billion and return about $1.39 for every dollar invested. And I should just mention that in our report, we also include the breakdown of the savings or the benefits, if you will, to the federal government, state government, and then to others. So if you're interested in the state estimates, you can see those in the tables of the report. Next slide, please. The renovation, repair, and painting rule, EPA's federal regulation that requires lead-safe work practices during the course of renovations in older housing or painting and repair work, is probably one of the most cost-effective solutions that we analyzed. The cost of compliance is fairly low and the benefits are very high, and you can see here that it returns about $3.10 for every dollar invested. One of the challenges with the RRP rule is that even though about 4.4 million jobs are potentially covered by this rule, EPA only enforced on about 100 of those in the last year. And so one of the recommendations is for states to consider adopting RRP as authorized states to enforce the program themselves. Some estimates show that the revenue potential for this particular intervention, if the state were to adopt, would be about $7.5 million per year for the state, because there are fees associated with the contractors needing to get licensed and certified to do this work safely. Next slide, please. This study was one of the few that has focused on what to do for children that have already been exposed to lead. I hear time and time again from parents that they 100% agree that we need to focus on prevention, but for those who are parents of children that have already been affected, they oftentimes feel quite neglected by the system and by the lead poisoning prevention efforts because they're too late for their children. What we are learning is really encouraging, though, that there are some interventions that you can use that will help improve the outcomes for kids that have a history of exposure. Now, importantly, things like early child care, high-quality child care, early Head Start, nurse-family partnership, some of those evidence-informed programs that you've probably heard of before have never actually been tested on kids with lead exposure. But what we do know is that they've delivered really good results in terms of academics and behavior for children that have other disadvantage, like poverty. And so we're working off an analogy here, which is that if you use these programs and implement them for children with a history of lead exposure, you can improve their academic and behavioral outcomes. And we use the social genome model to analyze the impacts of this. And so in the report, you can see how these programs, if implemented in early and middle childhood, can impact things like teen pregnancy, criminal conviction, high school graduation, et cetera. Next slide. And so here's just a summary of the best bets that we have in our report, best policy bets by water, paint, other sources. We do talk about food and consumer products, air, and soil in the report. I think one of the things we learned from this report effort is that you really have to be comprehensive. All sources matter, particularly at the low levels we're seeing in kids today. Low, and we say low levels, but it's really all relative in some ways. Low does not mean insignificant, and low doesn't mean not worthwhile to intervene on. As you could see, both from the economic tables and also what we know from the research, low levels still mean very deleterious effects, both from a health standpoint and from an economic standpoint. We make recommendations on screening, and then also making sure that kids, once screened, get the access to the services they need. And we also were really chagrined to find the lack of local, very fine-grained local data on exposure and risks, especially around lead service lines, around soil risks. It's just very difficult for community organizations and others to access in order to kind of figure out how best to make investments. Next slide, please. In terms of implementation, so there are 10 best bet policies, but there are about 70 tactics. And I'm just going to give you a very quick preview of a couple of those tactics that are mentioned in here. So I already talked about, on the regulatory side, enforcement of the renovation, repair, and painting rule. Another regulatory approach is code enforcement to make sure that checking for lead hazards is part of every regular certificate of occupancy for rental homes. Also getting state laws that require inspections and remediation, Massachusetts is an example of one. And then financing, as we heard in the focus groups, the need for resources to implement this work is significant. And so tax credits can be one option. And then there's a new innovation, the Children's Health Insurance Program, CHIP, is being used in Michigan and Maryland, and other states are following suit to pay for remediation. So why don't we go to the next two slides, and I'll just go ahead and walk you through those examples. City of Rochester, this one's near and dear to me. I'm from Rochester originally. When I grew up there, about 40% of kids were going to school with a history of lead exposure. They've made substantial progress. As you can see here in the bubble, they've gone from about 843 kids with blood lead levels above 10 down to 110 in the most recent year. And the Rochester lead ordinance, it can be credited with a good deal of that improvement. They basically require at the time when a rental property owner gets a certificate of occupancy that a visual assessment be performed. And then dust wipe testing. If you pass the visual, there's some concern that the landlord may have just kind of slapped on a coat of paint and may have created hazards in doing so. And so the dust wipe test is required when you pass the visual. They inspect about 14,000 units per year. This is a really scaled program. And then they do it again every 3 to 6 years, depending on the status of the unit. So that law was passed in 2007, and they have seen an 82% drop in blood lead levels over the course of this policy being implemented. Next slide, please. Massachusetts, this is one of the oldest lead laws in the country, and they require de-leading, which is a form of abatement covering lead paint. They also have tax credits to help offset the expense for owners to do de-leading. And they charge fees on certain professional licenses to generate a lead trust. And you can see here from 3,000 to 600 kids is the improvement that they've seen since the implementation of their law. Final slide. We'll skip the renovation and repair one and maybe just go back to CHIP for a second. And for the sake of brevity, I'll just say that there's lots of information on this program out there. It's covered in the report, but it's a really interesting innovation where states can ask for a state plan amendment using their CHIP funds for certain non-coverage related expenditures. And in Michigan, they're using this to pay for lead service line replacement, plumbing fixture replacement, lead paint hazard control. And Maryland is now doing the same, and I understand Ohio is following suit. So I think this is really worth investigating for states. And with that, I will wrap because I want to make sure you hear from my friend and colleague, Tom Neltner. Thank you, Doug.
Thank you, Rebecca. That was fascinating. Finally, our final speaker today is Tom Neltner with the Environmental Defense Fund. Tom is EDF's Chemical Policy Director. He leads efforts to remove or minimize hazardous chemicals from products and the marketplace through cross-cutting policy initiatives. His primary focus is on food additive safety and reducing exposure to lead in our homes and communities. He's a chemical engineer and attorney with experience in chemical safety issues in the workplace, the environment, the home, consumer products, and food. Tom serves on EPA's Children's Health Protection Advisory Committee and played a leading role in an EPA-convened multi-stakeholder work group that made recommendations to the agency to upgrade its lead in drinking water regulations. We're very pleased to welcome Tom to the webinar. Tom?
Thanks, Doug. I noticed a little reboot sign on the screen, which I'm hoping doesn't mean we'll reboot the webinar in the middle of it. So hopefully that's all okay. Jennifer gave you a big picture review of why lead's important, and Rebecca provided a great review of the opportunities that are out there and some of the solutions and some of the methods. What I want to do is drill down into the water side of it, specifically lead service line. If we could go to the next slide. So, I went too far. I'll go back up here. There we go. I just wanted to review a report that just came out from EPA this summer in a peer-reviewed journal at the Environmental Health Protection Perspectives. And it teases out some of those summaries that were in Jennifer's slide by looking at how are infants getting lead in them. And it shows the blue, the bright blue is water. And it shows that for most kids, water is the biggest source of exposure for 0 to 6 month olds. Those are primarily through formula. Paint that contributes to contaminated soil and dust is also a source, and there's a little bit of food down there. The next slide looks at it for toddlers, 1 to 2 year olds. And you can see that the water contribution shrinks dramatically, and it's primarily because those kids don't drink as much water as a formula-fed infant. Food goes up, the kids eat more food, but for many kids, paint from the soil and dust ingestion that's been contaminated by lead-based paint is the big source. And that's the one that really contributes the highest levels, as you see from that column on the far right side. You want to look at this, there are about 4 million kids born every year. So each of those boxes represents 400,000 kids stacked from one end to the other. So the most exposed kids are on the right, and the least exposed kids are on the left. So that just gives you an idea that water is important, especially for those formula-fed infants. So the question is, how much lead is too much? Well, as Jennifer clearly made obvious, is there's no safe level of lead, and blood has been found. That every time we look, we keep seeing problems at lower and lower levels. If you're familiar with the drinking water rule, at EPA, they often talk about 15 parts per billion, that 90% of the homes that are tested, typically that's about 100 homes in a large city, have to be below 15 parts per billion. That's not based on health. That's based on what is necessary to ensure that the corrosion control is working well, but it has nothing to do with health. We did look at EPA's report, and in a website, on a blog, we looked at it and said, for formula-fed infants, if you're looking at all those other sources of exposure, say houses built before 1950, where lead-based paint is common, that you really want the levels to be below 3.8 to keep the child below those current reference doses that Centers for Disease Control has established. Now, really what we want is that number to be 0, but this is at least a benchmark, a way of looking at it. Remember, there is no safe level of exposure to lead. The next slide gets into where much of that lead comes from in your home, and that's the service line. And you can see the water main in the street underneath the car, and it's connected to the house through that service line. That's the lead pipe that we're largely talking about. Lead pipes are also found inside of a home, but that's not so common. Most of the time it's copper or galvanized or plastic plumbing, but that pipe that connects up the house to the main, when it's lead, can contribute large levels of lead to the lead particulate to the water whenever it's disturbed. It can be disturbed because of a vibration in the street or the pipe being cut. That's why Jennifer pointed out that partial lead service lines, we only do half of them, or some alone half, can make it worse because it disturbs that pipe. You also see something called a gooseneck. Sometimes much of the service line is steel, but there's a little piece of lead to give it flex between the main. And when that's lead, that can also be a hazard. So we're really focused on the biggest source of lead that connect in drinking water, and that's the part that connects the water main to the house. We also have to worry about the house itself. One interesting point is these service lines generally were smaller than 2 inches. Rarely do you find them over 2 inches in diameter. So when you get to big schools and office buildings, lead service lines are a lot less common. The lead in the water there can either be from the water fountain or from the brass fixtures. The next slide gets into what's the state's role in helping to make this happen. Big picture, the states are responsible for enforcing and ensuring compliance with the EPA's lead and copper rule. That's a rule that says that we want to eliminate lead, but we may not be able to get there. So what we're going to do is require corrosion control, testing, education to consumers, and when lead levels look like they're too high, that's that lead action level, you have to start replacing lead service lines. So states have a critical role in implementing EPA's rule. They also have an essential role in educating the public and talking about the benefits and the challenges of replacing the lead service line. The other one is they can often set up policies that enable proactively communities to replace lead service lines. And I want to talk about 11 states in particular that are doing really good work in making that possible. They're taking proactive steps to enable communities to replace lead service lines. So what we want to do is I break those policies down into 5 categories. These are the 11 states, and actually other states are doing some as well. One is they can set a goal. That if you say, we're going to get all the lead service lines out, that focuses the state on the long-term goal of making sure that in 10, 20, 30 years, people aren't drinking water through a lead pipe. It's just crazy for somebody in 20 years from now to be drinking water through a lead pipe. But to get there, we have to enable communities to secure funding, because it's going to take money to pull these lines out. It's not, it's on the order of $3,000 to $5,000 to replace the lead service line. In some communities more, in some communities less. We have somebody in the office here who got it done by Washington, D.C. utility for $1,000. But we need to deal with the problem of the lead service lines on private property. Because when they're on private property, many utilities, many states think that they're the responsibility of the homeowner or the property owner. And when that property owner has responsibility, they may not have the money to put up to do it. So it really complicates the issue. The other part is knowing whether we have a lead service line or not. Just as with lead-based paint, a lot of homes don't know whether they have a lead-based paint. A lot of homes don't know whether they have lead service line. A lot of utilities are making progress on getting that information figured out and making it available to the public. And then the other one is mandating lead-safe work practices when the customers are getting their lines replaced. Even if it's full lead service line replacement, you're still disturbing pipe, and that can create some hazard. And then the other one is disclosure. If nobody knows where it's at, we're not going to make progress. So the best case is when you buy a home. This is a slide that lays out where states are. If you add up these 11 states, it's about 3 million lines are affected by these policies. That's about half of all the lead service lines that we know are out there. Now, these policies won't guarantee that we're going to get rid of all those lines, but it sets us on a path. 3 states, California, Michigan, and Washington, have set goals to replace all of the lead service lines. California has laid out a very specific process with specific milestones that utilities need to meet in submitting plans. Michigan's made it a broad goal by the governor that still has to be implemented, and Washington's done a survey and taken very specific steps. The next way is enabling funding. So there's 2 ways. One is allowing communities to use the rates that customers pay in their bill to replace lead service lines on private property. The idea being that these lead service lines are a public health threat, so we should be able to use this rate money to do it. Or disturbing them halfway, partials, create a bigger hazard, so there's a public health benefit. The other aspect is it's inefficient. You never want to replace half a pipe, you get it all done at once. That's Indiana and Pennsylvania. I consider Indiana to be the model on this one. They unanimously passed legislation that lays out 10 criteria that enables a community to be able to submit a proposal to the state to get approval for replacing the lead service line. Other states, New York, Vermont, Virginia, and Wisconsin, have set up grant programs to enable low-income communities to replace those. Wisconsin's the farthest along. They offered $25 million of grants, and it's really transformed the state into having some leading communities make progress. Inventories are out there. California, Washington, and Illinois and Ohio all have inventories developed or requiring inventories where you can find out where the lead service lines are, and it begins to remove the mystique, the opaqueness that hides behind, that lead service lines are behind. And only in Illinois is mandating particular practices, although the mandate was just to the state to develop those practices. And last is, we published a report where we looked at all 50 states and rated them, we graded them on an A to F scale on whether a home buyer is likely to be told whether they have lead service lines. We think that these policies are the way to go, and we see the real potential for states to move forward. And Indiana is probably the best model for Midwestern states, I would say. So, but it's happening at the local level without regard to the states, or sometimes supported by the states. These state policies make a difference. 14 communities, many in Wisconsin, have publicly set a goal of eliminating lead service lines in the jurisdiction. Almost 250,000 lead service lines are affected by those commitments. So that's real progress. Before 2016, we only had 2, Lansing and Madison, Wisconsin. 19 communities are taking important steps towards that, and they have not yet set a goal. The other one I wanted to highlight is this is our map of the states, so you can see how your state ranks. We are being approached every day by states, either advocates or legislators who are interested in raising their grade and making sure that sellers make informed decisions as to whether they have a lead-based pipe or lead service line before they move into a property. And we should be trying to advance again. It's not moving. If you could give me a hand here, Doug.
Tom, you'll have to click on the screen.
Clicking. Well, I know we're tight on time, but the last one was one of the priority areas. Well, there's been a lot of attention on schools is child care centers, because that's where kids are more likely to be, where more vulnerable kids are more likely to be exposed to drinking water. So we identified 5 states that require testing of child care centers. There are other states that also do it for schools. Connecticut, Illinois, New Jersey, Rhode Island, and Washington. And there's voluntary programs in Oregon, Michigan, and Cincinnati, Ohio. We did just learn that this week, Oregon has decided to require testing for child care centers. So the bottom line is there's a lot of progress to be made. States have a critical role in empowering communities to move forward, to achieving some of those goals that Rebecca described, and protecting kids like Jennifer described. Thank you.
Tom, thank you very much for your comments today. That was really excellent. I think we had a very good overview of the session from all 3 speakers. With that, I know we're going long on time, but I would want to bring up a couple questions here. The first one is probably directed at Dr. Lowry, but the question is, given the order of magnitude of the decrease of lead levels, can you comment on the IQ improvements in the U.S. following the elimination of lead in gasoline?
You know, I don't know that there's been any studies that have looked at the changes in IQ after the elimination. I haven't seen anything like that. I mean, I assume as we've had the decrease in children with elevated blood levels that has helped, but at the same time, we have a significant number of kids who continue to have these lower lead levels. And, some of the conversations that we've had with other providers, especially those who have been practicing for longer than me, is, yeah, but when I was a child, my lead level was whatever. And, I think we're just still trying to understand that there's probably different toxicity from the higher levels acutely and the lower levels chronically. So but I haven't seen any research on that.
Thank you very much. The next question I'd like to bring forward is for Tom. Tom, don't you think that the makers of lead pipes in the 20th century have some responsibility for the lead in our water?
I think there's questions, and in fact, there's an open lawsuit in California where the industry was being held responsible for lead in paint. I don't think it's been presented quite for lead service lines, but yeah, there's responsibility there. But we'll let the lawyers fight over that. The key is we need to start replacing these now. If you sit back and wait for those lead service lines, or for funding to come through, or for victory against that industry, we were going to have too many kids still in that canary cage that Jennifer described. I also wanted to mention that there is a lead service line collaborative. I put the rush on the slides at the end, that on lead service lines, there are 25 national organizations representing housing, public health, clean water, all the utility associations, who are all banding together to try to accelerate lead service line replacement in the communities. In the drinking water world, this kind of collaboration, such a diverse group, is not been done before. It's unprecedented.
And that's very good to know, Tom. And we will have additional information on the Lead Service Line Initiative on our website. The final question is going to be really answered by my final comments. There have some questions about funding for private side of the lead service lines. And that leads us into the comment that we will have a follow-on webinar to this one on November 17th at the same time regarding private financing for lead service line replacement. After that, we will have one more webinar in December, on December 15th, regarding notification and disclosure of lead service lines for private homeowners. And we hope you'll be able to join us for both those webinars. In conclusion, I would like to thank all three of our presenters for their time today and their comments that they have been able to provide. On behalf of the National Conference of State Legislatures, I would like to say this is Doug Farquhar, and I'd like to say thank you for joining us today for today's webinar. Good day.